about your part of the country. So I think we've got quite a busy slot this hour, so I will start, if I may. People are still joining. 39 on the call. This is great. So for those of you joining, I will say again, you are incredibly welcome. My name is Therese Patton. I am Chief Executive at Bradford District Care Trust, which is a mental health and community trust that works across Bradford and Craven District. We work in a very connected way in our place. We all have what we call distributed leadership roles across place, and my distributed leadership role across our place is as children and young people's lead for health and care, but that doesn't mean that we're not interested in all sorts of other things. So I am delighted to welcome you. I've got a bit of background noise on the call. Can you mute if that's possible? We've got lots of people. I've got a strange beeping in my noise. My ears. I don't know if it's me. Anyway, you are very welcome. So as I'm saying, my name is Therese Patton. I'm Chief Exec at the Mental Health and Community Trust in Bradford. I'm delighted to be just giving you a welcome at the start of this session today. This event is part of our Disability Festival, Connected on Disability Festival. This is the second year we've had it. We are incredibly proud that we're running this festival again. It was very successful last year, and it's all about our inclusion agenda. Inclusion is something that's really important to us, and when we talk about inclusion, we mean inclusion in all of its shapes and colours and sizes and abilities and disabilities. So this is part of our programme of work for the year, and I'm delighted, as I said, people have joined us from across the country, so you are very welcome. The focus of the session today is about disclosing disability, and I just wanted to say to you how important that is for me as the Chief Executive of the Trust. If I am going to think about how I can make my workplace as inclusive as possible for my workforce, then it's really important that staff feel able to disclose their disability safely and securely, so that we can make sure that we can make the workplace and the environment absolutely fit for their needs. And actually, I'm proud in our organisation that we've done a lot of really good work on the equalities agenda and people disclosing. We are struggling a little bit on the disability piece, so I'm interested this morning to see if we can get some ideas about how I can make my workplace a bit more safer so that people feel really able to disclose. So that was all I was going to say. I'm going to hang about here and listen to the session, but I'm going to hand over now to Kez, who's going to take you through the next hour. Thank you, Kez.
Thank you so much, Therese, and a wonderful introduction there. Again, a very warm welcome to all the participants on this call today. It's absolutely great to see so many of us here today. So my name is Kez Hayat. I'm the Assistant Director for Equality, Diversity and Inclusion at Bradford Teaching Hospitals. I also want to introduce my colleague Sonia Sarah, who's the EDI manager, who's been working very closely with me around some of the work that we've done around raising the profile of disability equality at Bradford Teaching Hospitals. So just before I start, very quickly, just some housekeeping, if I may. If everybody can go on mute, that would be really, really helpful. I also want to remind people about the chat function. So if anybody's got any particular question, any point of clarification, then please utilize that chat function as well, and we will aim to get back to everybody, even if it is after the session. So we're here today really to showcase some of the work that we've done at Bradford Teaching Hospitals in terms of disability equality, but also some of the wider focus around equality, diversity and inclusion. And we had a particular focus on disability declaration, and I'm really pleased to say that we've done some real targeted activity within the organisation around raising the profile of disability equality, but also the importance of disability declaration as well. So in this session, what we are going to be covering is exploring what equality monitoring is and the benefits of sharing personal equality information with our employers. It's also about understanding what is classed as a disability and also a long-term health condition, and how sharing personal information can benefit not just the employer, but employees as well. And again, towards the end of the presentation, we're going to showcase a video that's been produced by 6 wonderful contributors who have, in a really positive way, showcased how the organisation has supported them in terms of managing their disability or long-term health condition within the workplace. I've already talked a little bit about some of the work we've done in terms of raising the profile of disability, and the impact that that is making as well is what we are keen to share today. And last but not least, I think also it's really important to provide an opportunity for discussion and also for colleagues to be able to share your experiences in some of the work that you may be doing. And Therese has already mentioned some of the fantastic work that her organisation is doing around disability equality. Next slide, please, Ruth. So, in terms of equality monitoring, one of the first things that we really focused on when we embarked upon this journey of looking at improving, staff declaration, not just for disability, but for all of the 9 different protected groups. And absolutely, sharing such information about one's individual's religion, sexual orientation, disability is very personal. That's very personal to the individual. And obviously, a lot of the time, individuals, including our patients and the communities that we serve, are often reluctant in giving that information. So what we felt was that it's really important to spread that knowledge and spread that awareness across the organisation about why we're looking at, staff and colleagues to declare their personal information. So we really focused on the importance of it. So why sharing information is important? It absolutely highlights possible inequalities. We all know, working on whether it's workforce inequalities or community inequalities, then not having that evidence, not having the data to back up what you are influencing or raising the profile of, can become very challenging. Declaring information really helps us to investigate the cause of potential disadvantage. So in a previous organisation, I remember we were introducing a computer system, and that computer system identified that actually the staff within the organisation who have declared that they have dyslexia, therefore it was really, really important to really consider how we were going to engage and consult with those staff. So it really helps you capture some real pertinent information. It really helps to identify barriers to progression and achievement faced by individuals with protected characteristics. And again, we all know some of the evidence, some of the, inequalities that unfortunately exist within our communities, within our organisations. And it's only by focusing on our approaches to equality monitoring is where we get some real evidence-based information. It direct employee services to where the need is greatest, ensuring support processes are more accessible and focused. It allows us to fulfill our duty as a supportive employer, meeting the requirements of the Equality Act. And when I talk about the Equality Act, that's the general duty, which for me is not rocket science. And if we can just focus on them 3 arms of the general duty, equality, disclosing information, raising the profile of disability equality really helps the organisation advance the EDI agenda. And last but not least, it promotes and celebrates the diversity of our workforce. Isn't it fantastic where we've got days like International Day of Disability, Black History Month, and a whole range of other celebratory days. And when we're out in our concourse, which is quite a public area, it absolutely generates dialogue, it raises discussion, it allows people to approach individuals and just talk, and that's absolutely fantastic. Next slide, please, Ruth. So as I've said, the equality agenda is a complex agenda. It doesn't need to be a complex agenda, but often when we start talking about some of these complexities in organisations, it's really important that that awareness is really there within organisations. I remember starting my career in the 80s, and it was the Race Relations Amendment Act, the Sex Discrimination Act, and the Disability Act. However, with the Equality Act, it's introduced 9 different protected characteristics, and every single person on this call perhaps identify with at least 3 or 4 protected characteristics that are showing on the actual slide now. So very quickly, just to go through the public sector equality duty, as I mentioned it earlier, this is a duty where all public sector organisations must, in exercise of its functions, have due regard to the need to eliminate discrimination, harassment and victimisation. It's there to advance equality of opportunity. And I often say, gone are the days where organisations needed an equal opportunities policy statement and it was a big tick in the box to say, yes, we've got one. The Equality Act has been introduced to harmonise the different equality characteristics and to really focus organisations to focus on advancing the equality, diversity and inclusion agenda. And the last arm of that general duty is about fostering good relations between all of them protected groups. So having a good picture of the makeup of the workforce really and that equality monitoring will really help us to achieve some of these aims within the equality duty. So in terms of what is a disability, and most colleagues here will know, a disability is a substantial, more than minor or trivial physical or mental impairment that has a substantial and long-term adverse impacts, and the legislation often talks about 12 months or more on a person's ability to carry out normal day-to-day activities. Now, in terms of long-term health conditions, again, when we can cast our minds back to COVID-19, there was a lot of emphasis from NHS England in terms of understanding staff long-term illnesses, which could potentially impact them being in the workplace. And some of them conditions, long-term conditions, can be cancer, HIV, multiple sclerosis, and the list is endless, but also in terms of hidden disabilities, which often I feel a lot of organisations tend to experience lots of challenges and issues in, one, raising the profile of hidden disabilities, but also in terms of managing them hidden disabilities as well within the organisation. And some of them listed on there are ADHD, obviously autism, dyslexia, Asperger's, dyspraxia, epilepsy, hearing loss, anxiety and depression. These can all be long-term health conditions that would need managing within the workplace. So in terms of disability declaration at Bradford Teaching Hospital. So some of our commitment and some of our aims around this agenda was that we really wanted to focus on inclusion and belonging, where everyone feels that they can bring their whole selves to work. And we all know the positive impacts of when you are able to bring your whole self to work, the impact that that can have. So another driver for us was that our 2022 staff survey results showed that staff, 37% indicated that they have, 37% of the workforce indicate we have a diverse workforce, 25% declare a disability or a long-term health condition, and that's within the staff survey. However, that does not match in terms of our staff record in terms of ESR. And that's sort of stayed at 4%, although we've seen a slight increase, and we do believe that that slight increase, it's a start. And if we keep the momentum going and we keep focusing on our communication mediums and how we continue to raise this as an important area, then we are keen to see a year-on-year improvement in terms of our staff disclosure around disability. Next slide, please, Ruth. So in terms of BTHFT approach, and when you see the video as well, which I will shortly play, that was about bringing in an open culture within the organisation where staff do not have a fear of declaring disability. And what we've really focused on is working with our Disability Equality Network, which is the Enable Network, to really encourage individuals to have open, honest conversation with line managers. And on the other hand, with line managers, we've tried to focus on inclusive, compassionate styles of leadership and managers' roles, responsibilities in helping and supporting staff in the workplace, not just about disability, but a whole range of other areas as well. So we've really focused on, working with staff in having them open conversations. To do that, we've really looked at, what policy, what practice do we have in place? And we've developed a disability equality policy and a disability equality leave policy in conjunction with our disability staff network. And they've been very heavily involved in that, in helping us produce that. Lots of focus around flexible working. I myself am a working carer. I have a son with complex needs. Therefore, flexible working for me is absolutely paramount. But equally, having an open and honest conversation with my manager about what my caring responsibilities look like is also really, really important. So the openness enables the employer to identify wider issues faced by the workforce. So contributing your personal diversity information means everyone will ultimately have a better experience, and that's the focus that we have. Another area that we were really, really keen about was, how can staff release this information in the privacy of their own home, their own desk, their own laptop? And we really got working with our ESR colleagues to really look at how staff can go into the ESR record and simply update their personal information. But what was important is that we informed staff what we were going to do with the information, who's got access to that information, how the information is going to be handled, and then also inform staff that we would use this information anonymously to provide high-level reports. So at the moment, what we're doing is trying to do some analysis of with staff from which departments are sort of, declaring that information, but really focusing on ensuring that that information is strictly confidential. So, for example, when we do some of our high-level reports, if the numbers are under 10, we will not report, because we know that if numbers are low, people can be identified. So this is just an example to showcase, and I'm sure a lot of colleagues are very familiar with ESR, and basically we sort of navigate staff to go into the personal record and update that information, as I've just explained. So what we've sort of used, what we've called it is an equality census within Bradford Teaching Hospitals, is the campaign that we've developed. And we launched this campaign a couple of years ago, where we've developed a leaflet in some of the things that I've already mentioned in form of a FAQ, so frequently asked questions, whereby we've provided a whole range of information in terms of, details why declaring personal information is important. As I've already mentioned, clarity on what happens to the data. We've shared it via our internal communication mediums, via events, screensavers as well. And twice a year, we've managed to get an agreement that we will have a screensaver that will go develop sort of process for the whole of the month, so that staff can really see that message quite visibly as well. There's been lots of engagement with our disability network, and the next slide, very quickly, I will explain some of that activity. So in terms of our staff network, again, in the midst of COVID, there was a lot of focus and emphasis on, and at the time it was the Chief People Officer, Prerna Isra, who develops national ambitions for staff networks to ensure that where we've got staff equality networks in organisations, that them networks are actually thriving, and they're not just negative talking shops, that they're actually aligned with the governance and the decision making, etc. So I'm really pleased to say our emphasis was about completely reviewing, relaunching our staff networks, where we completely reviewed and refreshed their terms of reference. I'm pleased to say that they've got a voice on one of our most strategic decision-making meetings, which is chaired by our Chief Executive, Mel Pickup, where they've got dedicated agenda time, and they are actually influencing EDI from their lived experiences. They've got new branding, they've got protected time in terms of chairs, deputy chairs, and also a staff network budget. There's a lot of emphasis on co-production, and often I sometimes think it's a bit of a buzzword. So with our networks, we've really been key about what can we produce with you, how can we work with you in terms of your experiences, but with a focus on looking at things in terms of improvement and advancing that EDI agenda. And I'm really pleased to say that all three of our networks are working really well, and recently received an award, Nursing Times Award as well, for the work that they've done and achieved over the last couple of years. I'm really thought I'd just get that one in there. Absolutely. So raising the profile of disability equality has been absolutely paramount to us. Disability leave policy we've rolled out. EDI briefing for our managers is one thing that we've done, a half a day face-to-face session, and we make a promise to our managers that we will not be killing you by PowerPoint slides. This is a session where we create psychological safety, and we give the necessary information that a manager requires in terms of managing diversity in the workplace. And we're getting quite a lot of positive feedback about the benefits of having this half a day face-to-face session. And in these sessions, we talk about the role and remit of staff equality networks as well. And last but not least, we have a refreshed, dedicated EDI strategy, a 3-year strategy, which we are currently working in terms of implementing. It comes with 5 strategic objectives, and our work of our networks is aligned to the 5 strategic objectives identified within the EDI strategy. What's really helped us as well is being successful in the Workforce Disability Equality Standard Innovation Fund. So we applied for this fund. My colleague Sonia did some amazing, great work as part of this, and we were successful, which we've then been able to develop a fantastic display, which you can see there, which is quite a large display, which captures the stories of 6 contributors who work in the organisation, who positively talk about their disability and how the organisation supports them in terms of managing their disability. And again, given that it's on there, I will mention it again. We've recently received the Best Employer for Diversity and Inclusion by the Nursing Times Workforce Award. And that was with the majority of the focus of the work we've done around our staff equality networks, ensuring that they have a real voice in the organisation and how we've worked with them over the last few years in terms of raising the profile of disability. Now, what we're going to do next is play the video, and then we will pause for wider discussion, if that's okay.
I've been working at Bradford Teaching Hospitals for about 10 years now. At first, I was in the contact centre, but now I deliver training about the electronic patient record system, which means getting everyone up to speed on the computer systems that support a patient's journey through the hospital. Most of the training I deliver is face-to-face, which means I can be meeting new people every day of the week, and it's not perhaps something you'd think someone with depression and anxiety would enjoy, particularly on their bad days. It can be hard work, but I love my job. Part of my condition means that I'm often stuck in fight or flight, and I have to work really hard to compartmentalise that. It's like having 2 sides of my brain at war with each other. But my first managers at Bradford Teaching Hospitals really helped me with that. They made me feel respected, they mentored me and helped me when I asked so many questions. They didn't know anything about my condition, they just naturally helped to create a really positive and trusting relationship. And that encouraged me to be very open about my condition. If I have any episodes now, my current manager helps me with the reality check and I can tell her anything. I feel blessed to have joined a compassionate and supportive organisation. I feel blessed.
My name's John Prasher and I'm a non-executive director. The role of the non-executive director is to work with the executive team to assure the whole of the board of the organisation that we are continually improving our services, working safely, managing risk and improving the quality of care to our patients and rising to day-to-day challenges. I've been blind since birth. I was a premature baby. As I've got older, the condition has continued to get slightly worse, so I've now ended up with a guide dog to ensure that I don't trip over steps. I've got a particular interest in maternity services given my own personal experiences, and one of our roles is to attend trust meetings. Initially, when I started working for the trust, I wondered to what extent having a dog might be a problem, particularly in terms of infection control, but very rarely has that been an issue within the trust. And all too often, I find that Astley, my guide dog, is so much more popular than me. I'm very proud to be part of an organisation that rises continually to the challenge of respecting, valuing and including people from many different backgrounds and perspectives in everything that we do, and continually improving the way we offer and deliver services to our patients and communities in Bradford to make sure we become happier, healthier and at home longer.
I'm Akil. I'm 24 years old. I'm a Project Search intern. Project Search is an employability program for young people with learning disabilities. As an intern, I work in Bradford Royal Infirmary in a research team Born in Bradford, where I do database, Excel spreadsheets, birthday cards. I do the cleaning sheets. I have learned to communicate with the team, because at the start I was too nervous to answer the telephone call, but as I built my confidence, my telephone skill got better and better. Where I am heading is doing an apprenticeship for 18 months with the Born in Bradford team. It's going to give me an experience of a lifetime, because I've always wanted to work and get paid and to provide for my family in the future, and I feel excited about it.
For 15 years I worked in the theatres in Bradford, but when my rheumatoid arthritis flared up, I changed jobs to become an ID case unit nurse. When COVID happened, I had to shield because I was vulnerable to infection, and my mental health went rapidly downhill. When the shielding rules relaxed, the Trust found me a position working on the relatives line at St Luke's Hospital, which was started to keep family and friends in touch with patients when they couldn't visit. It made such a difference to families during the pandemic. My new role has changed my life. The team were all redeployed from other parts of the hospital, and it has been fantastic to work together. Sometimes we have very hard and sad calls to make, but we support each other through those, and it feels so good to pass on positive news. We feel part of the fabric of the hospital now, and my new role has enabled me to flourish in a new way. I've learned so much, and I feel so motivated to help people, and my rheumatoid arthritis flare-ups have really settled down too. It's been a hugely positive change for me.
I was diagnosed with Charcot-Marie tooth disease when I was 28. It's a condition you're born with that affects your nerves. This impacts on muscle strength, control, and also how you walk. Before I was diagnosed, I was really active. I was a nursing officer in the military and a nurse on the hospital wards here in Bradford. It was sad that my ward-based nursing career had to end. I couldn't stand for long and my balance was affected due to the loss of feeling in my feet. I considered taking another role within another organisation, but when the Trust heard I might be leaving, they supported me to move into an alternative role in operations. Ever since then, they've supported my development with leadership and management courses, and now I lead 2 large business units for the Trust, one related to urgent care and the other for elderly care. There are over 1,000 people working in the teams that I lead. On the days that I'm in pain, the team understand that, they support me, and I can easily adapt my working day. From exec level down, everybody has shown me their commitment, and for that reason, I'm committed to my career in Bradford.
My son Hassan is 26 and has a rare condition called Alström syndrome, which means he has full loss of vision, difficulty in hearing, and also other conditions such as type 2 diabetes. Only 700 people in the UK have this condition, and it means we travel to Queen Elizabeth Hospital in Birmingham, where he receives his medical care by a multidisciplinary team. Much of my life has revolved around taking care of Hassan and going with him to medical appointments. We also really enjoy getting out and about together. And I have to say, I am so proud of the man that my son has become. When I first joined the NHS, I was so excited about my role. But when the pressure of being a carer increased with Hassan's needs, I thought I might have to give up my job. What was important to me was to be open and honest about my situation. And ever since, it's been a true give and take relationship. The NHS support has meant I've been able to really thrive in my leadership role, and also champion the carer's passport, which allows colleagues to have those vital conversations about the flexibility needed to combine work with care. My experience has taught me that it all starts with really disclosing what's happening for you. It means I'm able to do my job well at work and at home too. To have that kind of backing from work is life-changing. Thank you, colleagues. That brings us to the end of the video. I'm sure you recognised one or two faces in there. And I was meant to say earlier on, which I didn't say, was, you know, disability by association is also a thing that we've really focused on in recognising that our employees can also be carers as well, and their association with disability. So I hope you enjoyed that very enlightening video. Every time I see it, it sort of makes me feel quite emotional, because it takes a lot to share your personal journey, to share your personal information. And I can only thank all 5 of the different contributors who came forward and worked very closely with us in order to do that. So again, thank you to all the contributors there. I'm very conscious of the time, colleagues, and I think it's really important that we did open